Nothing like a good doctor. Good morning, everybody. Welcome to my channel. I am at the heart and vascular section of WakeMed here in Raleigh, North Carolina. This is my first visit after 30 days from the surgery. And what I want to do today is interview the surgeon that did the surgery and then have him talk about how he did this. What did he do to open my chest? Which I think it will be of interest to everybody. So without further ado, I'm going to start by introducing Dr. Judson Williams. He is a leading cardiovascular and thoracic surgeon. I have to read it, I'm sorry, but I can't remember everything. During his career, he has received numerous awards and acknowledgement and was named top doctors by the North Carolina Business Magazine for 2 years in a row. And so the first question is, this is Dr. William, okay? How did you open my chest, and was my heart stopped, and was a device took over the function? And that's my first question to you.
Well, it's a great question, and Carlos, it makes me so happy to see how well you're doing less than a month after your surgery.
Thank you.
And for all your viewers, this is not to be expected for every patient, but we're thrilled with your progress. And even the first day after the surgery, I remember coming to see you, and you were already out of bed. You'd already stood with the nurses. You were smiling and greeted me as if it was just another day. And I think a lot of the success you've had in your recovery has been that positive mental approach to the operation. I remember us talking about the different techniques for doing the surgery, and we have robotic approach, off pump, on pump, and your surgery was done on pump, which means there is a cardiopulmonary bypass pump that supported the circulation to the body and did the work of the heart while we worked on the heart doing the bypasses. So the heart was stopped for a brief period of time, about 40 minutes, to do all the different bypasses that we did for you.
Okay, wonderful. And how did you get to my chest? Did you use an electric machine, or did you use a long shears, or did you just crack it and open it?
It's a great question. You had an inferior sternotomy, so we opened the breastbone in the midline, the lower part, and that was with an oscillating saw. So there is a saw that is made for that, and you're right, it is battery powered.
Oh, it's battery powered.
Yeah.
You know what I'm going to do right now? I'm going to let my audience see my scar. Oh boy.
Oh no.
All right.
I'm buttoning the shirt.
I'm buttoning so they can see what the scar looks like. And that's what it is. It's a perfect surgery as far as I'm concerned. Okay, now I got to be modest again, okay? And be modest about it. My other question to you, Dr. Williams, is... I'll get this. All right. That's better. See, the doctor is helping me out. Nothing like a good doctor, let me tell you.
That's right, and nothing like a nice, clean, loose-fitting shirt that buttons in the front that you're not having to lift your arms up to put on. And
right. So. You know, at the beginning, I couldn't do a button shirt. I was using T-shirts because the buttons bother my surgery thing. Yeah. But anyway, one of the things that the nurses did while I was here was got me out of bed pretty soon. And so I learned a thing that is called ERAS and the carbohydrate loading.
Yes.
Now that's a big mouthful even for me, but please explain those two things.
Oh, I love talking about ERAS, which we sometimes call ERAS, which is Enhanced Recovery After Surgery. And essentially it is a protocolized approach to cardiothoracic surgery care in your case, which means applying best evidence in the pre-op, intra-op, and post-op phases of the care in a standardized way, and we make all these little, sometimes subtle changes to the traditional pathways that results in an aggregation of marginal gains and a big impact for patients like yourself. We were the first US based ERAS program for heart surgery in the country back in 2016, and the carbohydrate load is one of the more frequently discussed parts of it, but it is essentially the idea of getting away from the historic you can't eat or drink anything before your surgery, to understanding that, well, actually, to prevent dehydration, to prevent insulin resistance, to stimulate gut and pancreatic function, it is better to have broken that overnight fast with a carbohydrate beverage, and that's what you did 2 to 4 hours before your operation, that we do for all patients, and we've seen improved gut function and improved blood glucose control with that carbohydrate load. Yeah.
Does wine falls into that category?
Wine does not fall into that category. I think you are reaching the point in this recovery where if you want to have a glass of wine, it would be.
Thank you. Okay, another question for you. What can a patient do to prepare for a good outcome and better recovery?
Oh, that's a great question. The word for that is called prehab or prehabilitation. Historically, it was all about focusing on the rehab, the recovery afterwards, but there's a lot a patient can do before the surgery to be prepared. One of the things I remember that you did was staying active and walking. Certainly with blockages in the coronary arteries, we don't want the patient having chest pain or angina symptoms, but to the extent that you are able to walk and stay active, that's important. We will even sometimes, in patients that need extra help with mobility, do physical therapy prior to the surgery to improve balance and physical function. That's very helpful. And then weight management, so healthy management of a patient's weight, of their blood glucose control is also helpful to get ready for surgery. And then smoking cessation or vaping cessation for patients who use tobacco products is important prior to the operation as well. Those are just some of the key ones. Yep. But I love that question, Carlos, because prehab is definitely the way of the future, to really not just worry about how do I recover after, but let's think about how do I put myself in the best possible shape for the surgery itself.
Yeah. I know that when we started to do this, the nurses and gave me a lot of information about what to do beforehand, and they walked me all the way through, which was great. I think the staff here did a wonderful job to walk me through all those things. In the after recovery, when I went home, we'll talk more about that, or the things that I did on my own to, with the help of my daughters and my son, to recover faster.
Now, my memory also, Carlos, I want to stick to your questions, but my memory was you had almost no pain.
Never had pain.
After the surgery, which I think is a big misconception, that this is a very painful ordeal. And I remember you having a smile on your face and saying that you didn't need any of these opioid pain medicines.
I didn't need any of them. I never had pain. I don't know why, but
I think
it was your good hands.
Well, I think a lot of it is the ERAS that you were talking about, and the way the smaller incision, the breastbone being put together in a rigid way, and the smaller chest drains. And most patients don't need any opioid medicines when they go home after a bypass surgery.
Wonderful. Yeah. All right. Now the other one is, we just talked about this, the pre-surgery protocol and what to do, and what makes a good candidate for open heart surgery.
Yeah. There's a lot of different reasons for open heart surgery. Of course, it could be a valve problem with the heart, could be a weakening of the heart, a heart failure. could be an aneurysm in a blood vessel to or from the heart. In your case, and by far the most common worldwide, would be a blockage in one of the arteries of the heart that needs a bypass. And a good candidate for a bypass is often a patient with multiple blockages in multiple arteries.
Interesting.
Tends to be a very good candidate for bypass surgery, and that's called multivessel disease, as opposed to a more less complex blockage. May be easier to manage just with medications or with stents.
I learned something. I mean that if you have more problems, it's better for you.
That's right.
Okay. What is the biggest challenge in the OR? Is it infection? Is it, what?
It's a great question. I think building the team is the biggest challenge in the modern operating room, and the surgeon is just one component, certainly an important component, but just one component of that team. There's nurses that specialize in the circulation of the room, the management of the room, the administration of medications. There's specifically cardiac trained anesthesiologists. There's perfusionists that run the heart-lung machine. There's nurses that specialize in assisting with the technical aspects of the procedure, the instruments and the sutures. And so the surgeon and the patient are depending on all of these other team members to be experts. And even the technology of taking the vein with the minimally invasive approach from the leg and the camera involves one of our specially trained physician assistants that are expert in doing that portion of the procedure. So I think management of the team would be the most important thing intra-operatively.
Right. Well, that's great. I don't personally remember anything of that. I don't even remember going into the OR at all.
And I don't remember what music you asked for, but I do remember they asked you what type of music, because everyone knew you enjoyed music very much.
I do.
What do you think you would have said for them to play while you were going off to sleep?
Probably Mark Anthony. Would have been one of my favorites. I'm not sure right now which one I said.
And I don't remember. It's been a couple weeks.
So, is there anything a person can do in order to prevent bypass surgery?
Well, I think you're a great example of living an active, healthy lifestyle does make you a good candidate for heart bypass surgery. It contributes to your longevity and your wellness, and you're a great example of that. But it also shows that some of this is factors that are outside of our immediate control, and it's family history and it's genetics that play a role in acquiring cardiovascular disease. And it is one of the most ubiquitous conditions that we as humans face is atherosclerosis of the arteries on the heart. Certainly we know of risk factors as well. Smoking is one, obesity, having high cholesterol and lipids, as you and I were discussing earlier. All of those, of course, are additional risk factors.
Okay, thank you. Here's a question for you. If you could do anything as a full-time career, what would that be?
Wow. Well, I think I'd have to say cardiac surgery, and that's what I tell the medical students and the trainees that come through. I feel like this is really a passion and a calling.
You know why? Because with your looks, I figure you would be in Hollywood and you would be a heartthrob. No pun intended.
Well, I did try my hand at professional tennis briefly, and that didn't work out, so I went back to medical school.
Is there anything else you want to add to our conversation?
No, I appreciate the conversation very much, and I'm really proud of you, and I hope the video with your subscribers is helpful to many of them.
I think it will be. And so, I want to thank Dr. Williams and his whole staff and the people from the ICU and in the regular room where I was. Everybody, I felt I was number one patient. And so I would recommend WakeMed Heart and Vascular to anyone who is looking to have the same surgery. And please don't hesitate to do it. If they tell you need to do this and you say, well, I don't know, put your hands in God and in the doctors that you have, and they'll get you through it. So with that, yeah, sort of. It's not a salute, but okay, ready?
Yep.
Thank you very much.
That's great.
I thought it was a great video.
Yeah.
Yeah.
I think it's gonna be really good.
He's